We are here in Dental de Classe Clinic. We are having a discussion with Dr. Chris Elueme, the MD CEO of Dental de Classe Clinic. What are we talking about? Very interesting topic. You have a child, you have a toddler, you have a baby. We are talking about them in this conversation, in this meeting. So pay attention so you know how to go about taking good care of your children's teeth, because it is better to catch up with this information of how to go about it. It's going to help you a big deal. It's going to save you the money that you would have put in to take care of their teeth if there is a damage, if there are diseases, if there are infections. But if you start early by taking these kids to see the dentist, so that there will be a level of maintenance, you're not going to have to pay fortune to treat. Rather, you're just going to pay a little to maintain your teeth. You want your teeth to look good. You want them to be healthy. You are going to have to listen to this discussion. Stay tuned. Don't go anywhere. Catch up with us. We're right here. Thank you. Bye.
This will be running smoothly. The biggest gen we have from the house, we got the gen here, like, we have to stop. That's how it's moving.
That's a good one. Hard in our mouth. So I believe we want to learn.
Okay, this is the model of a door. Looking at one of our patients who's like now a family friend, let's go visiting. I went to that room. I want to move in there. She said, where? I said, that's that building. Okay, that building, we paid for it. He said, yes. Doctor, we not do that.
This is your theater, right? It's where you do all the work. People come out having beautiful smiles. Everything happens here. Can you tell us more about this equipment? What does it do?
Well, this is dental chair. This is everything about dental.
Wow.
What we call intercepting methods or preventive methods that can be carried out. You can't just say at that time that the child is places. The child also has to develop. The developmental stage is where you need to catch something at that time. Child suffering with tongue thrusting, some things you can correct. Habit breakers come into play.
Hello, Dr. Elueme. It's nice to be with you again today.
Thank
you
you.
always make our day good.
Thank
I
you.
know today is another better, beautiful day.
Okay.
And as usual, you always teach us things we need to know. They say health is wealth, right? So this is why we are here again today, to get more information, to know the right thing to do in order to have that health is wealth. Thank you so much. We appreciate you. Okay, now we're talking about the startup. How is your startup like? So if you can tell us more about it.
Yes, I told you initially that I started from one of the rooms in the flat, and how my wife encouraged me, and also a patient. Then I was alone. Then she now said no, she had to join me. Then we moved in here, and initially we were like, was it God that sent us? And was a bit shaky, but it was exactly what we wanted. Then a patient of ours then was like, okay, don't worry, we get it is bigger than this, and not to worry. So we used to look at this beautiful building from BQ then, and we used to love it. And we used to tell people that we moved into this beautiful, and my wife was like, Then, God, I used to call her, I always call her the woman of faith.
Wow.
And she just tell me, okay, we move in there and all that, not to worry. Then one of her friends said she wanted an apartment, and we came in here and found out it was going for rent and for lease, and They were shocked, like, this place is beautiful. You mean you're not staying here? I said, no, it's for rent.
Wow.
We came in and we loved it, and we paid, funny enough.
Wow.
God be the glory, we paid, and we've not moved. We're just still waiting. We were that perfect.
Wasn't the rent running? Since you have paid.
We paid in January, last week of January, so I started reading from 1st of February.
Okay.
Then weeks, weeks, and we were looking at, so one of our patients, who's like now a family friend, just came visiting, and we told her, we want to move in there. She said, where? So we're like, okay, no, initially she started by saying, no, doctor, this place is too small for you. I'm praying that God will give you a bigger place. So you have a place. I said, where? I said, that's that building. Okay, that building, you paid for it. He said, yes. Doctor, we are not doing start.
You need to start fast.
And I said, no, the rent is going now. No. She said, let's go there. So we now came here. She said, no, this place is beautiful. Her doctor said, this place is excellent. And I said, no, but we need. She said, doctor, you have one dental chair. Put it here. I said, no, I'm not putting that one there. I've gotten a new one. She was like, then what are you waiting for? Put that new one here. Start with this ground floor before you move to the upper floor. I was like, no, we both looked at her and said, no, that's not the vision we have. We have the vision of vision. I said, no, you have to start small. He said, we need to get AC, the banks are tossing us to and fro, go and bring your grandmother's wedding certificate. The picture you took from your fishing pond was not colored, this and that. And she said, start. You want one AC there, put one AC there and put fans there. And I said, no, we don't want to do that. Then one of our artisans, the guy that mixes our ACs, I said, he can help us move. Then another man came in and said, I wanted to tell you guys to just move what you have, and because your rent is running. Yeah. He said, no, we
what month was it?
We're talking about ending of March.
Wow.
And that's
2 months already gone.
2 months already gone. And we're like, okay, no, let's do this. Okay, we need a nurse, right? And there's a nurse I've been begging and saying, please, you say you're going to move. I hope you're not employing somebody else.
Who is that?
There's no, she had to relocate.
Okay, nurse that want to work with you.
Yeah, don't work with her. She had to relocate to Abuja because her husband is there. So she now came and said, please, madam, you said you employ you. Okay, are you employed now? I said, no. Come in on the 30th of March. Come and see the place. Let's interview you. We interviewed her. I was like, well, I had reservation. My wife said, don't worry. Let's work with her. So, well, you say so. You're the boss.
Yeah.
Then there was another doctor that was on ground. I said, okay, let's start at least. Let's move in first. So she just came on the 31st. We cleaned everywhere. I got one of our technicians to move in. He said, he wanted to tell me things, but he didn't want to be too forward. And we should start with what we need. And later we'll expand and we'll grow. So we said we need AC. We got all the ACs from the house and said, we're moving in there.
Yeah.
And all the furniture, we got the furniture. If you're already here, we got more things. We got the ACs, we're just replacing them one after the other, then sending them back home, to where they were taken from. And they want to go in, and some we just have to let them, they just take them, we don't need them anymore. They're old. So we have to now get ACs here.
Wow. Then
gradually the upper chair. Then each time we're having our meditation, my wife will say, this place is well equipped, the office, the 2 dental chairs. I was like, sister, calm down. So I said, no. I said, okay, I have paid for just 1 dental chair. He said, no, it has to be 2. I was like, no, see, this is the plan is I've already negotiated and I'm ready to get 1 dental chair. They will put the old one, and I said, never. The old one has to go. I want new dental chairs in all the clinics. I'm like, okay, is that what it is? But interestingly, I was now talking to somebody else and I said, okay, I can give you a dental chair. How much do you have? I told him how much I had. He said, yeah, that will fly. Then you pay within 1 month. I said, of course, within 1 month, you pay your money. The other person said, okay. In short, the other person said, okay. And before I could say their problems, he bought the dental chair.
Wow.
My wife looked at me and said,
look at it. She told you you're going to get
how many do you have now? Then we came the office here, we got the rug. That's when you came in.
Yeah.
And we're like, wow, this place is already set. So we're still getting more things. You're like, no, but what I'm seeing here is already set. So we got the flowers, we got more things as time went on. We kept on evolving. One of our patients will say, each time I come, I always see something different, something new.
Yeah,
and that's how God has been, faithful to us.
This is a very good story.
Evolving.
Your startup has been
and we are still moving.
Even though from the story you have told about your startup now, it's not been the way you thought it was going to be. Exactly. But you learned something there, which I understand that a lot of people hearing this, they're going to learn that you start from where you are. Don't wait to have the big things. If they are not forthcoming, make do with the one you have that is small, because that small one is going to carry the big ones in. So your startup was a good one. And today, look at where you are. It's a big place. Your story is a good lesson.
Thank you
for everyone, even for myself. Thank you
really?
So much. Yeah. Thank you so much.
You're welcome.
Yeah. Doctor, the human teeth is classified as incisor, canine, premolar, and molar. What is the function of each and every one of these? And can you show us which of them is the incisor, the premolar, the molar, the canine, and what they actually do? We want to know. Most people don't even know, this different type of teeth that we human has in our mouth. So I believe we want to learn.
Okay, this is model of a jaw. That's the mouth with the teeth in it, the gum, the tongue. Okay, now this is known as the central incisor. That's the center of the teeth. You will start from here down, down. This is the midline. So these are the central incisors. After the central incisor, you have the lateral incisor. Then you have the canine. Then you have the first and second premolars. They are called premolars because they are before the molars. So before the molars. Okay, so this is the first molar, this is the second molar, and this is the third molar, known as the wisdom tooth.
Okay, that's what they call the wisdom tooth. I've just learned that now. Yeah.
So this is actually, both of these teeth here are used for cutting.
Okay.
This is actually used for tearing. That's why you have the predators. They have these ones like the cats, the dogs. They are very prominent. They are longer and sharper. Then these are the premolars. They are used for chewing.
Okay.
Then the molars are larger and they're used for grinding.
Okay.
So you bite with this, you tear with this, you chew with the molars, with premolars, and you grind. You can see the surfaces are different.
Yeah.
You understand? So you grind with it.
Okay. Can see.
Then the tongue will help you roll the food in your mouth, then you swallow.
Wow. That's fantastic.
I hope I've answered your question.
You have. You did. Fantastic.
Thank you.
So today we're actually talking about kids' teeth.
Okay.
Right. Because you see, parents need to be aware of the care so that their teeth can be, well taken care of to prevent teeth decay, toothaches, and all that problems that are associated with when one does not take good care of kids' teeth. At what age should parents start using toothpaste and toothbrush for kids?
Well, we always say it's best to start cleaning the teeth actually from when you first see the first tooth erupt into the baby's mouth.
Okay.
And of course, then you don't need to use paste.
All right.
But when it's time for you to start using paste is when, from the age of a year old, even less than that, from 0, below the age of 1 year.
Okay.
You can start, like I said earlier, when you see the first teeth erupt in the baby's mouth.
Okay.
And we have toothpaste that have been fabricated
For that.
for that. We have 0 to 12. Some company like I know of Colgate
Okay.
that has 0 to 2 and 2 to 5.
All right.
So while McLean's have 1 to 6, and a lot of them have 1 to 6.
Okay.
But Colgate in particular has 0 to 2,
Okay.
taking care of the dental need of the child at that early stage.
Okay.
And so it's best, mother will be taught when you come to the clinic how to brush the child's teeth
Okay.
at that early age, because a lot of times they are not used to spitting out, they swallow everything.
Exactly, even when they're brushing,
Exactly.
they swallow everything.
So we teach the mothers how to brush
Okay.
the baby's teeth. We have the finger brushes, and we also teach them the size of the toothpaste and the fluoride content of the toothpaste. That is suitable for children of that age range. So that even if they swallow it, they don't get the fluoride poisoning. That really is the concern of a lot of people out there.
So what's the percentage of that fluoride, if you can?
Well, usually
so that
less
when
than
they
one,
buy, they know what they look out for.
It's less than 1 parts per million, usually 500.
Okay.
For children. Well, some manufacturers will take it lower, but that's the ones I've seen so far.
Okay, so even when they swallow it, it doesn't do any harm to them?
No, because the size you're actually meant to use is not, when you see adverts, sorry if I'm using a bigger brush.
No, it's okay.
You see the adverts, you just say, okay, Pepsodent toothpaste, they just go, pew. No, it's actually meant to be pea size. Just tiny
just
a little bit, yes. And for children below the ages of 2, or between 0 to 2, we usually talk about the rice size.
Okay.
There's the grain of rice, the size of a grain of rice.
Yeah.
So for children younger, because they are not going to spit out. The finger brush.
Okay.
Then you have brushes for children below the ages of 5, and you just use the pea size. And sometimes I recommend have pea size, because you don't want a situation where a lot of parents are not even there.
When they have
the maids, they have the housekeeper, they have the nannies. So those ones might be distracted. As soon as they do, they just go. So you just say have pea size. So
when you say P, you're talking of the letter P?
No. P as in the peas.
Okay.
No, PEA.
Yeah.
So you just go have the size of a regular size of a pea. Then you just go and you brush. So in case they forget,
to spit it
even
out.
if they squeeze it out to the size, they not end up going to the size of the original pea that you want. Okay. So make sure your child is safe even though you're not there.
Okay. So kids love sweet things after sweet consumption.
Yeah.
What should parents do to prevent tooth decay?
Well, I always tell parents that you don't, I want to put it in a way where I would communicate the right thing. The thing is, you don't say don't take sweets.
Okay.
I'm a sweet tooth.
Yeah.
So you don't say don't take sweets, because if you don't give them, they'll get out there. My daughter growing up, then I remember when they bring party pack, I was like, the one day I saw her put something in her mouth, I told her, don't do that, that's a pen. She looked at me, I said, no, it's not a pen. I said, it's a pen.
Sweet.
She said, it's sweet. I'm like, sweet. And I'm like, see, it's sweet. I was like, sweet? So what do you have in your party pack? Was practically nothing there.
Yeah.
Sweets, biscuit, chewing gum, all
sorts,
refined carbohydrates. So the child is not taking sweets at home, then taking sweets at school. I remember there was a situation where I was treating a child, and I was like, okay, madam, your child had a lot of dental caries. That means you gave your child sweets at night. She didn't even allow me land. No, doctor, what are you trying to say? My children don't take sweets. No, you're more or less telling me I don't know what I'm doing. I was like, madam, let me land. She said, no, doctor, you don't know what you're saying. They don't take sweets. I don't give my children sweets. So the younger child was like, mommy. I know she was just like raising her voice. I just smiled like, madam, calm down. He said, mommy, he takes sweet at school. Then you're like, what?
Oh my God.
You know, he takes sweets at school. And that's why I told the mother, you see, you can give your child sweets. And my daughter, I don't deprive her from eating sweets.
But you know, sweet is good for them because they are children. They need it. Because when they are, you know, sometimes they are hyperactive. They burn out the sugar. So the sweet they're taking is actually helping them because they're still children.
No, not exactly.
It doesn't help them?
No.
Oh.
The thing is, it's just because it pacifies them.
Okay.
Who doesn't like sweet things? Nobody gets honey put in his or her mouth and you spit it out and say, I don't want. Honey is sweet. We all know we love honey.
Yeah.
So it's sweet, but you just have to help to balance it for the kids. Like I tell mothers, particularly mothers or parents when they come, or guardians or whoever, or the wards, or whoever is taking care of the child. I said, look, the thing is, you have to learn to give these children sweets, biscuits. You sign contract with them, in quotes, you know, like, okay, you know what, this is your meal, but all the ice cream and all the stuff are here, but you have to finish this. Take your ice cream and biscuits and brush your teeth afterwards.
Exactly.
So I tried that with my daughter, and now she has this habit of brushing her teeth before she goes to bed.
Wow.
You have to brush your teeth at least twice in a day. See the dentist once every 4 to 6 months.
Okay.
And she doesn't miss her appointment. In fact, she comes to the clinic and tells the nurse, my appointment is due. I need to see a dentist. And they're like,
yeah, your dentist.
Your dad is the dentist. So, okay, no, I need to be seen. I need my clinic needs to be done. They were like, yeah, calm down. But they're not used to the fact that the child is coming in to ask for their appointment.
Okay.
And here in Dental the Classic, we make sure that the children have a pleasant experience.
Yeah, I can see it.
A family about like Adaza, your niece.
Yeah.
They will come in and we make them feel, look, you are in charge. Whatever you want, we'll do.
Yeah.
But we have to have an agreement. You know, first you do this. What do you want?
Exactly.
You go that way. Okay, can I have a look? Okay, you have to be private, just me and you. Tell me everything. Mommy have to face the other way. You know, we just play any kind of game. I try to read the child. I try to reach out to the child's emotions, because that's the way, when you read the child's emotions, they'll trust you.
Yeah, that's true.
So I tell parents that that's what you need to do. Let them take the sweets after mealtime.
Okay.
Because when they do that, they're full. And the quantity they want to take is less compared to what they would have taken on an empty stomach.
Yeah.
So then they now brush. And you know, kids, you know, the Bible says, train up the child in which the child should go, and when the child grows up, he will not depart from it. So they get used to it. Okay, I take my food, then follows the dessert. You just pick one thing. That's just the truth, because you're full.
You know, this is something to actually ponder over. Kids, when they have a lot of sweet things, tell them to come and eat good meal, they don't eat.
They're full.
So they make you cook, at the end of the day, they don't eat.
Yes.
So from what you said, parents should actually let them eat their food first, because they will be actually full. They'll be filled up. Their tummy is, their stomach is actually small, and when they have eaten the food, when it comes to sweet, they just take in little.
That's just it.
I think that's the best thing.
Yes, because when they eat the food, particularly a favorite meal, if it's rice, and they eat to your food, and you now offer them drinks. They just take a sip or two and like, no, mommy, I'm full. Okay, can I put it in the freezer for you or in the fridge? Yes.
Then they're going to wake up the next day and go quickly look for it.
Exactly. And by the time you do that 1, 2, 3 times, you know this is the rule. Finish your food, you take your dessert. Pick anyone you want. And at the end of the day, they're taking less quantity of refined carbohydrate. That's number one. Number two, the child then develop this evasive character where they can tell you lies and they can manipulate things.
Exactly.
And at the end of the day, you're not just dealing with dental caries, you're dealing with the child's manipulative and evasive character, where the child will now learn how to steal, how to lie, how to cheat, just because they want the desserts. They'll go to school. There's a child I knew that came to the clinic once. He told me in confidence that, look, that money will not give me sweets, so where do you get them from? He said, when I go to school, my brother and I finish everything and we come back and say they didn't give us anything.
Oh.
And that's bad.
That's really bad.
Because right now,
they're living in fear.
They're living in fear. That's number one. And number two, they're learning the invasive part of life, which is not healthy.
It's not good for them.
For children. Now they learn to keep secrets. Get into drugs, they can tell you.
Yeah.
Because they've learned to be evasive. They can be abused and they will not tell you. Because they've learned to be evasive, they learn to keep things to themselves. But if they're open and you're like, you know what, take anything you want. I'll give you sweets. And my daughter takes all sorts to school, but sometimes she comes back and like, I'm too full to eat. I just go, there you go.
Yeah, but okay. Okay, what precautionary measure should parents put in place to protect kids' teeth as well as preventing their teeth from issues that can be a problem in the future?
Yes, first and foremost, they must have what we call a dental home.
Okay.
Where you teach a child how to first brush, the culture of brushing.
When you say a dental home, what do you mean? Is it dentist, the clinic rather?
No.
Or is it in the house where they can always learn how to brush?
Yes, exactly.
Okay.
They have to learn the good oral hygiene.
Okay.
Where they would say, okay, you need to wake up in the morning, you brush your teeth. Okay, you floss.
Okay.
After every meal, if you can, or last thing before you go to bed.
Okay.
Then you also brush as well. Okay. Avoid eating, anything, cracking bones, bottle caps, nibbling on pins, safety pins, pencils, pen. Just nibbling on anything apart from food. Then avoid chewing on ice. Okay.
And they do that a lot. Exactly. They like ice. They go to the freezer, they open up and they start picking those things, putting in their mouth.
Exactly. But as a child, I did it. It was fun.
Wow.
But I didn't know that.
Okay.
Now I know better.
It's no good.
So then you now tell them, okay, you need to see your dentist once every. You take your children to the dental clinic. See your dentist once every 4 to 6 months.
Okay.
They undergo scaling and polishing.
Okay.
And also fluoride therapy. The fluoride therapy actually strengthens the teeth. Because
how does that work? The fluoride therapy?
The fluoride, yes, what it does is it strengthens the teeth and increases the resistance of the teeth to dental caries.
Okay.
Then also they need to undergo restorative or preventive dental treatment where they go and they have their teeth filled or called fissure sealing.
For the ones that have holes already?
Not really.
Even if they don't have holes?
No. You can see the teeth have grooves. So some people have deeper grooves.
Okay.
So it's best for you to fill them up. So because these are where the
so they're not supposed to be sore?
No.
Oh really?
If they're too deep, you can't brush. The brushes the bristles of the brush cannot get there. So the safest thing to do is fill them up. The procedure known as fissure sealing.
Wow.
So you fill up the fissures.
Very educative.
Exactly. So you fill up the fissures. Then you see the dentist once every 6 months, 4 to 6 months, depending on how. Then they teach them what to take, when to take refined carbohydrates, how to take them, and at what time you shouldn't take them. You avoid taking them in between meals, like I said earlier on. Because when you do that, you actually increase the acidity of the mouth and make the teeth prone to decay and all that. So, and if you're taking refined carbohydrates too, of course, now, like I tell a lot of people, in this era, you have a lot of refined carbohydrates. In fact, I can say boldly that over 90% of the food that we eat are refined carbohydrates.
True. I agree with you.
I just found out recently that the white rice have been low.
It is.
It's refined. My wife told me, I was like, no, it can't be. She just brought out Google. I told Miss Google.
It is.
She now brought out Google. I was like, whoa. You mean it's also refined? I was like, God.
That's why a lot of people eat the brown rice,
Brown rice.
and then the native
I didn't know
rice.
that. I didn't know that because
Yeah.
I'm on a diet now, so they're telling me not to eat. I'm like, no, rice is safe. It's natural. It's good. I said, no, it's not. I'm like, how about this? He said, no, it's not. I'm like, oh gosh. So what exactly are we really eating then? It's not
Honestly,
refined.
Yeah.
So if you're saying even rice is refined, then tell me what else
That
is
means
not
everything
refined.
is refined.
You know, I just like, okay, so a lot of these things are refined then.
Yeah.
Very small amount, very little amount of food, of crops
Right,
there that
yeah.
are really natural. So a lot of times she even told me, not even her, I even got to discover that a lot of these things are hybrid. For instance, the broiler chicken we eat
Yeah.
are hybrid. Some of the cows, the beef we eat are sort of like, oh really? So they're not really directly from nature.
Yeah.
And we know these broilers are fed with hormones so that they can grow within a short period of time. So a lot of things. So at the end of the day, you find out that they're not really eating the natural stuff. So that the best thing is teach them how to brush, flossing, okay, drinking water more often. Avoid taking, if you have to take juice, you have to be natural juice, orange, pineapple, just eat fruits, lots of fruits and vegetables. You know, kids will always be kids, but you just have to make sure that you have an all-round monitoring. You have a system where you have reminders who are very vigilant and also who are not lazy, who are ready to make sure they are tending to the child as and when due. Yeah. Because children need prompt attention.
Exactly. Within a second.
Exactly. You just need to be sure that you have someone who is attentive, no matter how you feel. Okay, my child is disciplined. They are adventurous. Children want to know. You know, as a child, I was this kind of one that I'm always very curious. I want to know what is behind something.
See, when there is fire, they want to put their hand into it.
Yes, our Christmas decorations, I smashed one of the balls because I was curious. I wanted to know
what's inside.
No, not even what's inside. In my head, will it crack? Oh. What will happen? I used to have this thing in my head. What will happen if I do this?
Oh.
You know, I just smiled and it cracked, and thank God I was alone. If not, I would have received the rod and the staff.
You know, there's this thing about children that I've come to see. They have this boldness. They're not afraid until they've done that thing.
Yes, and that's where you need to have someone who is around them most of the time, particularly when they are toddlers, to make them understand that there are consequences for doing the wrong things, and there are rewards for doing the right things. And also you also have to guide them to know so that they can know when to stop.
Wow, parents, you've heard that. Excellent. Yes. So if a child has serious teeth issue and the only solution is braces, and this child is between the age of, let's say, 2 to 6, would you advise the braces to wait, or within this age bracket, is it possible that the child can still have the braces on? And how long, if a child has braces on, how long will the braces take to correct or solve the problem?
Well, for starters, you can't wear braces for children below the age of, or at that age range, because first and foremost, because below the age of 5, they're not they still have their baby teeth. Then above the age of 5, that's when they now start crossing to what we call the mixed dentition. So you need to see your dentist. The dentist will tell you when is best. There are what we call interceptive methods or preventive methods that can be carried out. You know, you can't just say at that time that the child needs braces. The child also have to develop. The developmental stage is where you're able to catch some things at that time. The child sucking, is it tongue thrusting? Some things you can correct. Habit breakers come into play, and also you have other things, other appliances that can be worn by the child at this growing age, at this stage. So usually, not at this stage, you don't know. You can't really say per se that the child needs braces. Some children, I've seen some children have developed and and they end up not needing braces unless you want that perfect smile. So they can live with what they have.
Okay, that's fantastic.
Yeah.
Okay, doctor.
Yes.
This is your theater, right?
Yes.
It's where you do all the work. People come out having beautiful smile. Everything happens here. Can you tell us more about this equipment? What does it do?
Yeah, this is the dental chair. This is everything about the dental.
Wow. Yeah.
This dental surgery. So you have a dental chair.
Okay.
Okay, and each part has its own functions. This is where you control the chair from. You can see it from rectifying.
Okay.
And move the chair forward and backward, up and down. Then the light is sensor.
Wow.
It's sensitive, so you can put it on and off. Yeah?
Wow.
Then the intraoral camera where you show patients in the mouth and
Wow.
Let's do it this way.
Wow.
And take a picture.
It's like an X-ray?
No.
Okay.
This is the X-ray machine.
Okay.
So this is the camera. This is the whitening lamp. We use it as for teeth whitening.
Okay.
Okay, and this is the UV light for teeth restoration of teeth.
Okay.
It's like most of the materials we use now are light activated.
Yeah.
So UV light, you can see it's covered, so you need to go on.
Okay.
So it comes up and down and all that. So that's just basically it. Then you have a tap water runs in there, here.
Okay.
And these are the hand pieces that you use in working.
Okay.
Here. And the three-way water, jet water, and this is ultrasonic scaler for scaling and polishing. That's basically, and that's the suction.
Okay. You used to suck out the.
Yes, so you have to squeeze out.
Okay.
So that's just
What about this one?
This is X-ray machine. Yeah.
So one does not need to go outside to get X-ray done and come here.
No,
just come everything is just
it's
here.
Everything is there.
Wow. It makes it easy.
Yes.
Oh,
So digital X-ray. So that's what it is.
And you have 3 of these here.
No, I
In
don't
this
have.
building.
I have 2, one here and one downstairs.
Okay.
As at the first surgery. So we have 3 surgeries. This is the third one.
Yeah.
Second one is where you see the specialist cases.
Okay.
Braces, implants,
Wow.
veneers, and this is where they do most of the work there.
All of it is done here.
Then every other surgeries are very regular dental procedures are being carried out.
Well, that's wonderful. Well done, doctor.
Thank
You
you.
make life easy for us.
Thank
I
you.
remember when I did my braces here, it was very easy for me.
Yes,
and now I
thank
can
you.
smile very well. I have beautiful smile.
That's a good one. Thank you.
Really good.
Thank you. So that's just what we do here. So we clean after every patient.
Okay.
That's where we go.
It looks very clean.
Thank you.
What are the diseases that are associated with poor care, poor dental care?
Well, there are numerous diseases actually associated with poor dental care. We could start with the local kind of disease where, for starters, we have what we call the gingivitis, gum disease, that can progress to what we call periodontal diseases. And that's when the tooth becomes mobile and you have pores, there's dental abscess and all that. And also you can have what we call cellulitis from there, you can have logic angina from there, and so on. Then you can, of course, in the common one, you have a cavity in the tooth, with a poor oral hygiene, not brushing regularly, and poor oral eating habits as well.
Okay.
So you have to be, you also have to understand that these are just what happens in the mouth.
Okay.
Now, the mouth is the doorway to the body.
Oh yeah.
Now, there are
That's right.
diseases that are known to be associated with poor oral hygiene.
Okay.
For instance, you have when you have some heart diseases, endocarditis, infective endocarditis is one. When as a result of the infection in the mouth,
Okay.
And you now have bacteria seeding into the system.
Oh, this is terrible.
And yes, and now you now seed and you now lodge on the valves of the child or individual, and you now have what we call it valvular heart diseases and all that. Then you could also have low birth weight in children, particularly when pregnant mothers don't have very poor oral hygiene.
Yeah.
Then you could also have other diseases like abscesses. I've seen where someone died of brain abscess as a result of poor oral hygiene. So the valve actually is connected to all parts of the body.
This is, eye-opener.
Yes.
Because you see, nobody wants to go through all of this mentioned.
Yeah.
So for that reason, I think everybody should
see your
pay
dentist
attention.
once every 4 to 6 months.
Yeah, so that's
very important. Brush twice daily, floss once, at least once daily.
Yeah.
When you see your dentist dentist will tell you what to do.
What to do, yeah.
And how to take care of your teeth.
Exactly. So how, or at what stage of pregnancy should parents factor in the plan on how to take care of their babies when they are born, their teeth?
From inception.
From inception.
Yes. When you're pregnant, you also have that one in mind because the baby teeth starts forming in the first trimester of pregnancy. So when mothers fall ill and they have poor health and poor health, it reflects on the child's dentition.
Wow.
Yes. So you have to, it's from inception. You don't
Many women will not even know about it.
Yes, and that's why I tell people that dentistry is just beyond just saying, oh, you have a toothache and you want it out. No. It's all encompassing. That's why dentistry is an independent specialized arm of medicine with its own various specialties too. So you need to factor that from the onset. Oh, goody, I've done my test, I'm pregnant. Then you also have to have that in mind. And like I said earlier, low birth weight babies are associated with poor oral hygiene. Yeah. So they need to see their dentist at least once every 6 months. That's at least, it becomes worst case scenario. Once, one time during their pregnancy.
Wow, that's beautiful.
Yes.
That's really beautiful. As a dentist, what will your general advice be for kids, babies, between the age of 2 and let's say 12, because they are not yet teenagers? It's when they're 13, they will be teenagers, right? And also for the parents, what will be your general advice?
See your dentist once every 4 to 6 months. Very important. You start from there. Learn how to brush twice in a day. Fluoride containing toothpaste. And when you see your dentist regularly once every 6 months, then you will know how to effectively take care of your oral hygiene.
Thank you, doctor.
Thank you for having me.
There's one thing I want you to do.
Okay.
I want you to look to the audience.
Okay.
What we are talking about here is about dream come true. If this dream hadn't come true in your life, you won't be sitting here and you telling us this.
Okay.
So you're going to talk to someone who has a dream right now. They don't know how to go about it. Just summarize it. Give them just 2 points on how to go about the dream. They've heard about your startup, how it was. But today, look at where you are. Big clinic is here for you. Secondly, I want you to talk to parents, not children, not kids right now, because kids, they will hear from this part of the here, the next minute is gone. They can't remember what you told them before. So to parents and to someone who has a dream, might not be a dentist, but might not be in the medical field rather, but might be in another field, but all the same, a dream, right? So just speak to them.
Well, to the viewers at home, I would like to say you just have to first believe in yourself and avoid naysayers. A lot of naysayers, a lot of, like what you said earlier on, there are a lot of dream killers, and there are people who will tell you it's not possible. But if you know and you trust God, He will guide you, He will teach you, He will instruct you. It's not everybody that comes in the name of from God that really understands the vision, because God has given you the vision and you know how to run with it. So all you need to do is just ask God how to go about it. And also, I want to encourage you never to give up. You know, it's never too smooth. Like it might not really happen the way you want it to, but just know, for surely and steadily, God will grant you your expected end. God bless you.
Okay, one question.
Okay.
Plain still water and milk is the best choice of drink for a child. How true is that?
Yes, because water is essential for life, and milk is also essential for growth, energy, and development. So, what else do you need?
Wow, that's all. That's all. Makes it perfect and complete. Thank you so much, Doctor.
You're welcome.
Thank you.
Thank you.
So much. Really appreciate you. And God bless you.